Hey there, I hope you're having a good day. One thing really quick, do you know what syphilis is?
Syphilis is a sexually transmitted infection, STI, that may have debilitating and fatal symptoms. Treponema pallidum is the bacterium responsible for the transmission of the disease by direct contact through sores called pancreas.
From sores during the primary stage, fever, fatigue, and muscle aches during the secondary stage, and fatal impacts on the cardiovascular and nervous systems during the tertiary stage, which can happen 10 to 30 years after the initial infection.
The primary, secondary, and early latent stages of the disease are curable with a single injection of benzathine penicillin G, while the more advanced latent stage and tertiary stage require weekly injections.
In a study conducted across 77 countries, the global pooled prevalence of syphilis from 2000 to 2020 was 7.5% among MSM, meaning around 1 in 13 MSM have syphilis, while Latin America suffers a higher prevalence of 10.6%, or around 1 in 10 MSM.
A staggering 4.6 million people currently have syphilis in the region. Despite following prevention efforts established by the Pan-American Health Organization, syphilis incidence and prevalence has increased over the past 3 years, and countries like Argentina report prevalences 4 times higher than expected in some municipalities. This is a trend that was magnified by the COVID-19 pandemic, since community health centers across the region experienced closures that may have affected availability of testing/screening, prevention technologies, and treatment for both MSM and the general population.
Out of the 7 million new global syphilis infections worldwide, 859,432.8 cases were from Latin America and the Caribbean, meaning that around 12% of new cases globally came from this region alone. If we calculate these statistics, this translates to 200 cases of syphilis per 100,000 persons in the region per year.
Sin embargo, la prevalencia y la incidencia de sífilis varía en cada país de la región. Entre MSM, Argentina, Panamá y Costa Rica tienen las más altas prevalencias con 15 a 20%, cada uno seguido por El Salvador, Perú, Brasil, Paraguay y Haití con 10 a 15%.
MSM experienced a disproportionately high burden of this disease, as co-infection rates with HIV were calculated to be 38.5%, with 47% among Black MSM and even higher 77.8% among Black MSM aged 45 to 49. This is a worrying statistic, considering that syphilitic cankers facilitate the transmission of HIV and that complications due to co-infection can be life-threatening. In a study in Brazil, co-infection was only 19.5% among participants, not just MSM, showing how there are structural inequalities that lead to these disparities. But why do we as MSM need to be specifically concerned? At an individual level, MSM are at risk if they decide to engage in sexual relations with multiple partners, and if they do so unsafely. In fact, research has shown that co-infection of syphilis and HIV has increased, possibly because hookup apps allow for more sexual relations with multiple partners, and with lower levels of precaution because people use PrEP to prevent HIV, but do not prevent against syphilis. And, fun fact, in the survey conducted in Mexico by the largest hookup app worldwide, Grindr, 63% of users planned on making up for lost time by hooking up more than usual after the pandemic, which could also attribute to the spike in syphilis cases among MSM, and would also project an increase in syphilis and HIV co-infection in the coming years. Interpersonally, being unable to negotiate safe sex practices such as effective condom usage, routine testing, faithful monogamy is another risk factor. This is magnified by the fact that a third of enrolled members in a syphilis prevalence study engaged in sex work and were unable to communicate these safe sex practices, showing how working and living conditions can be a risk factor. Similarly, being or living in low-income areas increased risk factor because of decreased access to preventative sexual health care. And although most studies focus on female sex workers, it has been determined that male sex workers experience twice the societal stigma because of sexual orientation and their type of work. Societal stigma is an issue for all MSM because it has been shown to decrease the likelihood of them seeking adequate prevention/treatment from healthcare centers for fear of discrimination, but also because health policy makers underestimate the gravity of the issue and do not create effective programs, which in turn reduce availability of syphilis resources for MSM. I mean, did your parents teach you about safe gay sex? Yeah, me neither.
Good thing the Pan-American Health Organization and the CDC detail important measures that countries and individuals can take to reduce the spread of the disease. Although abstinence is the only way to avoid sexually transmitted syphilis, Effective condom usage, routine screening and testing, efficient communication with sexual partners, and being faithful in monogamous relationships all help reduce the risk of contracting the disease.
Most importantly though, I need to reemphasize that syphilis is a curable disease. So, as long as you know the facts and follow some recommendations, who's saying you can't have some fun?